The latest numbers from the U.S. Consumer Product Safety Commission show there was a 50% increase in deaths and injuries from fireworks-related incidents in 2020, with more people handling fireworks on their own after countless public fireworks shows were canceled. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about common fireworks injuries and the best ways to stay safe while celebrating the 4th of July. With me today is Dr. Dana Rioux-Forker, a hand surgeon at St. Luke's Health System. Thank you so much for joining us.
It's a pleasure. Thanks for having me.
So, Dr. Rioux-Forker, about 10,000 people are treated in emergency departments every year for fireworks injuries, 15,000 in 2020. Most of those happen around the 4th of July holiday. What are the most common types of injuries that you see around this holiday?
So we see the full spectrum of injury. Predominantly, patients are being injured in the hand as they're manipulating these devices. Studies show that 35-40% of patients that present to the ER have a hand injury from fireworks. The next largest proportion is the face, so those projectiles typically. Of those patients having face injuries, 20% are having a globe injury. When I say globe, what we mean by that is eye. Of those patients, 70-some% of them will have full or partial vision loss for the rest of their life. So they're, very significant injuries that are happening to the face and the eyes. Then there's also, the typical burns people get in other spots, the belly, the legs, that sort of thing. So kind of the full spectrum of injuries.
Yeah. So as a hand surgeon, what injuries have you seen firsthand that are due to fireworks?
So when we talk about injuries to the hand with fireworks, the more significant injuries we tend to see are explosive injuries, people handling mortars, firecrackers, things that are exploding in their hand. Because of that, there's a large portion of patients that are having an injury to their dominant hand, 70-some%. Both hands is 40-some%. Patients are typically having 2.5 to 2.8 fractures in their hands when it happens. Most patients are losing some portion of a finger. Of those patients, I believe it was 40-some% had partial amputation to the thumb. So they're really devastating injuries. These patients on average are having 3 surgeries with the maximum, there was a patient that had 15 surgeries. So they're really devastating injuries that alter their function lifelong. And we see them affecting everybody. One study showed patients that presented to their ER ranged from the age of 1-year-old all the way up to 61. So it's anyone that could be manipulating these explosive devices.
Absolutely. So what are the best ways to stay safe and prevent fireworks injuries if you are planning to handle fireworks this year?
Yeah, the National Safety Commission has made some recommendations in terms of fireworks safety. First and foremost, in terms of who's manipulating these objects, they don't recommend any younger children manipulate them. Use them even with direct supervision. For older children, teenagers and such, they should be directly supervised at all times. You shouldn't mix fireworks and alcohol or other substance abuse, substances, because you can't react as quickly to situations going poorly. They recommend you only do 1 firework at a time, so you're not holding things that may operate differently. Having a bucket of water around. For anyone around fireworks, including bystanders, you should wear goggles, or safety glasses. We see projectile injuries quite frequently with bystanders, and so that can help protect them from suffering a globe injury. You should also, when a firework doesn't go off, douse it in water. You shouldn't be looking in a tube. You shouldn't be manipulating it in any way. You shouldn't relight it. You should treat it as it could explode at any time. Any used or unused fireworks should be soaked for numerous hours before disposing them, because you can also start fires with this. If you put it in your trash can in your garage, you could potentially lose your home. So just, acting as if they're explosive devices that could go off at any time. Okay,
all great reminders. So what types of fireworks cause the most injuries?
It depends on the patient population that you're talking about. In terms of the highest number of patients coming into the ER for a particular firework, it's actually sparklers. 25% of patients that present to the ER have a sparkler injury. So that's typically the younger demographic that you're looking at. In terms of the most predominant firework bringing people into the hospital, it's going to be your mortars, these big explosive devices. Then when you look at the most severe injuries, the most surgeries patients are requiring, that sort of thing, it's typically the homemade or illegal fireworks, because that's just increasing the amount of gunpowder and explosiveness, as well as potentially how it's being manipulated in an unsafe manner.
Okay. So St. Luke's offers an innovative surgery for patients who have suffered blast injuries or amputations. Can you tell me a little bit about that surgery?
Yeah, so in the last decade or so, targeted muscle reinnervation has come to the forefront in hand surgery and plastic surgery. What that is when patients suffer amputations for any reason, we see them commonly in the diabetic population in the leg, or, in the military population, patients having severe gunshot wounds, infections, whatnot. What ends up happening is there's nerves that are cut, big nerves that carry sensation, that carry motor function, and those nerves try to regenerate, they try to heal. And what that frequently causes in this population is a big scar ball of nerve, which is terribly symptomatic, meaning debilitating pain for these patients. So much so that oftentimes they can't wear a prosthesis or different things like that. We see this similarly in the hand with amputations, or even in fingers with amputations sometimes. And so there's a new surgery we can do where we transfer those nerves to a new target, to a new home, which gives them a new job to do, rather than creating this painful nerve scar ball. So, pain management, symptom management is kind of the origination of where this came from. But then as our technology has grown, we've figured out that we can create prosthesis, or the prosthetist can create prosthesis, where they put little patches onto the skin and they can pick up the nerve input to muscles. And they've been able to generate prosthesis that pick up that nerve input and then move fingers independently, move the wrist independently, just using brain power.
That's amazing. So what's your final message to people who are watching today?
Yeah, in terms of firework safety, be cautious about what you're doing. Treat these as explosive devices. Don't mix explosives with alcohol and drugs. Be careful about what you're letting your kids do. Make sure you're always supervising them. And just be thoughtful about how you're enjoying your 4th of July.
Absolutely. Well, thank you again for joining us.
Yeah, happy to be here. Thanks so much.
To learn more about the expertise of St. Luke's plastic surgery specialists, visit stlukeskc.org/plastics. You can also stay up to date with all the latest health news and patient stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.